Good evening and welcome to RFL. I'm Rick Unger in for Richard French. Now, we here at RFL know there is a lot of anxiety and fear out there, which is only natural as we enter into these uncertain times. I know I'm feeling it, and so is everybody else tonight. Tonight, we're gonna talk about the source of that anxiety, coronavirus. Now, we're going to do it from several different angles. We don't have all of the answers. Nobody does, but we're going to speak with a bunch of experts and professionals who will show you exactly where we stand. We're going to discuss what's coming and whether or not our healthcare system and food supply are really ready for it. Now, we have a doctor who runs one of the top hospitals in America who will tell us how the healthcare system is responding and what it can expect to deal with in the coming weeks. Then a one-time head of FEMA joins us to discuss what needs to be done to make sure everyone is fed and cared for as quarantines and curfews spread. We'll also speak with the former congressman from a swing state on whether Congress will take swift action to help mitigate the financial hit countless businesses and millions of Americans are dealing with. But before we get to any of that, take a listen to what President Trump had to say today, which is a major change in tone for him.
You're not saying it's under control, right?
I'm not referring to it, meaning the... Yeah, if you're talking about the virus, no, that's not under control for any place in the world. I think I read, no, I didn't. I was talking about what we're doing is under control, but I'm not talking about the virus.
Now, I believe that's the first time the president has used language like that. Now, before we get to our guest, here's a look at the very latest on the virus and its spread.
Across the country, dramatic actions are being taken in a desperate effort to slow the spread of the novel coronavirus. Even more states closing public schools. More than 30 million students kept at home, while full states like Ohio and Illinois and major cities like Denver and New York City are outright banning dining inside restaurants and bars.
This state is doing this state is doing this city is doing this. It's chaos. I think it actually feeds the feeling that the country's out of control.
And as the number of confirmed cases rises in America, the medical community is only hoping to keep up with rapidly increasing demand. More states like Florida introducing drive-through testing facilities, ventilator manufacturers attempting to ramp up production during the pandemic, while concern is growing that care providers and hospitals are running out of masks. Medical officials urging other professions like dentists, painters, and construction workers to drop off their masks at local hospitals. Globally, Europe has become the new epicenter for the crisis. Italy reported its death toll has surpassed 2,000, with hundreds more dying from the COVID-19 virus today, despite a total countrywide shutdown. Here in North America, Canada has now closed off its borders to foreign nationals, though Americans are exempt for now.
These measures will help save lives.
A possible sign of hope today in Washington, the first clinical test of an experimental vaccine. Researchers calling the speed it's been developed unprecedented, though Dr. Anthony Fauci of the National Institute of Health tamping down expectations.
So although this is the fastest we have ever gone from a sequence of a virus to a trial, it still will not be any applicable to the epidemic unless we really wait about a year to a year and a half.
As the virus spreads in the United States, health officials are trying to prevent the U.S. from becoming like Italy. The Surgeon General was asked about that today. Let's take a listen.
We're at a critical inflection point. We have the same number of cases now that Italy had 2 weeks ago.
Do you think we can become Italy?
I think you've got several different models, and yes, there is a potential for us to become Italy.
Dr. Stephen Klasko is president of Thomas Jefferson University, also the CEO of Jefferson Health. He is, I will tell you, one of the better futurists when it comes to healthcare and our healthcare system in this country. For that reason, I tell you, he has an upcoming book. It's entitled Unhealthcare, a Manifesto for Health Assurance. Stephen, great to have you with us today.
Well, thank you, and appreciate everything you're doing about getting information out to the public during this difficult time.
Well, that is the key thing to do. Now, I am very familiar with Thomas Jefferson Hospital, and I am well aware of the fact that you are one of the few hospitals out there who are probably better prepared than most, and I know why that is. What did you people do over at that hospital following the Ebola problem?
Well, one of the things that we've recognized, these different pandemics or epidemics we've had, like H1N1 and SARS and Ebola, if you believe in God, it's a little bit like God's testing you. And each time that one of those happens, then everybody just breathes a sigh of relief, like they'll do when this is done. It's all right, now we're done. We made two decisions. We made a decision that most of healthcare really needs to happen at home. So we created one of the largest telehealth entities in the country, and we're now doing thousands of telehealth visits so people don't have to come to the office. But the second thing we did is we kept our emergency preparedness group together after the Ebola crisis. And that means that we have enough masks and gloves and ventilators and all the things. We were preparing for this, hoping it wouldn't happen, but knowing that at some point it would.
Well, that's terrific. I will tell you, though, based on our research here, as you call around to different hospitals around the country, unfortunately, they are not in as good of a position as Thomas Jefferson Hospital appears to be. There is extraordinary stress among the administrators of these hospitals that if that curve we keep talking about, if it goes way up and we don't flatten it, they are not going to be ready for what's about to happen. What is being done out there to provide these folks with the help that they're going to need so that they are not overrun?
Yeah, and we've actually been involved with really looking at the curves with this particular one. And look, I think the social distancing thing makes a whole lot of sense. Probably should have been done a little bit earlier. I think the key is we're all working together. So in New York and Philadelphia, we're working with rural hospitals as to how we can help, how we can start to look at where we can put people in different places. We're actually talking to hotels about folks that really don't need acute care, of how we can bring nurses out to where they are. We're talking to our sports teams once we get enough testing kits that perhaps we'll do the testing in those sites. So look, I think the good news is that at least on the private sector, the private not-for-profit sector, the providers, the insurers are getting together and saying, we need to take care of everybody. This is not a Columbia versus Cornell or a Jefferson versus Penn issue. This is how do we take care of everybody in every city.
All right, so you're making plans to have rooms to put people in, beds to put people in. Here is a question I never envisioned having to ask, and that is, what about the ventilators? What about the respirators? There's no scenario that I have come across, with the exception of you, because we've spoken about this, where the hospital administrators, the doctors, think that they have enough of this critical equipment they're going to need to keep people alive. Are you aware of any factory in the United States or anywhere in the world that is now into 3 shifts a day to produce more of this equipment so we don't run into the problem that Italy ran into?
Yeah, look, and I think, please understand, we're not prepared for anything. There are scenarios that in any of these situations that can break the bank. But I think here's what is happening. What is happening is that the places that do have these are letting go of all their inventory. The problem is that, making a ventilator is not just something you do overnight. And it has to be tested and all those things. So the issue is going to be really smart management of the people that need to be on the most up-to-date ventilators or on them, the people that can be stepped down or stepped down. It's going to be a bit of a wartime philosophy if things get to the point where they very well might. And remember, the real key, Rick, is keeping those elderly people. And unfortunately, we define that as 60 and over, especially with chronic diseases, because the folks that aren't in that category that get coronavirus very often and most often do not need the most acute care.
Interesting. Well, you talk about those elderly people who are going to need it, and I'm still kind of hung up on the ventilator thing. My understanding is that one piece of equipment that would make the difference, because so much of what happens to people happens in the relationship between their heart and their lungs, it is that ventilator. Are cities or states going to create ventilator banks? So if you happen to be a hospital that isn't using all of yours, it can get shipped into a bank where other hospitals that need it can call upon it.
Yeah, I think that's a possibility. I think what will most likely start to happen, at least in areas, will be trying to get patients down to the hospitals that have them, because some of that is also, it's not just the ventilator. It's, that the hospitals, the academic medical centers that have more of the ventilators also have more of the specialists, et cetera. So some of this will be triaging folks to the places where the sickest people can get the best care.
So my sense is, Stephen, that the big city hospitals, they're always the ones who seem to be set up the best for most of anything. What about rural hospitals in rural America? What's going to happen there?
Yeah, listen, the whole so look, some of this gets into what you and I have talked about before. We don't do a great job in health policy in this country, right? And I think that whether it's caring for the urban hospitals that take care of the poorest, or the rural hospitals that don't have the people, with urban hospitals, it's more about they don't have the money. In rural hospitals, they don't have the specialists. So post-COVID, I'm hoping that we start to look at these things very differently. During this crisis, I think what's happening, and we're talking to a lot of the rural hospitals, we're working with trying to get them the kind of supplies that they need that we can. We're working with them on trying to ambulance or helicopter folks that need to be cared for at a place like ours down to our place. So we're doing what we can. But look, Rick, you've done a great job on all of your shows talking about the fact that it's not just giving people access. The Affordable Care Act gave people access to a broken system. We have to fix the system.
Well, you know how much I do agree with that, Stephen. Dr. Stephen Klasko, he is the CEO of Jefferson Health in Philadelphia. Look, we're going to stay in touch with Stephen and every other physician out there who's got answers for you, who can give you advice, who can help you get through this really difficult time. Stephen, Dr. Stephen Klasko, we appreciate you being here with us.
Rick, thank you. And just to all your listeners and watchers, just stay with your family. This will get better, and just really have faith and listen to what the CDC says and do the right thing.
Thank you, Stephen. Up next, empty store shelves, panic buying of things like food and toilet paper, and new concerns people will be stuck and unable to get what they need. The former head of FEMA joins us after the break to discuss how the government should respond.